Hi guys, welcome back. This is part 2 of acid-base balance. If you haven't watched part 1, please watch part 1 so part 2 can make a lot more sense. On this video, we're going to go over how to figure out this acid-base balance and finding out if the patient's compensating, if they're fully compensating, partially compensating, or not compensating at all. And just a very quick overview. In part 1, I told you how when the lungs are in trouble, the only guy that can save the day are the kidneys. And if the kidneys are in trouble, the only guy that can save the day are the lungs, right? So if the kidneys are in trouble and the lungs try to help, what they're really trying to do is compensate, right? And if the lungs are in trouble and the kidneys try to help, when the kidneys are trying to help, what they're really trying to do is called compensation, because the name of the game, as I said in part 1, is homeostasis. Okay, bringing back that balance. So what's the balance I'm talking about? I'm talking about pH. Your pH is 7.35 to 7.45. That's what we always want to keep the pH. So when the lungs are in trouble and that pH is not between the 7.35 and 7.45, the kidney goes into action, or it's supposed to go into action. And when the kidneys are in trouble and that pH is not between 7.35 and 7.45, the lungs are supposed to go into action. So make sure you guys watch part 1 so it all makes sense. So now this is part 2. Before we even get into these problems, guys, I did a Google search and this was the first sheet I found, so I printed it out. So there are plenty of questions that you guys can practice, okay? Before we get into these questions, let's talk about this, because you have to remember, when we're talking about the lungs, breathing, the lungs are responsible for carbon dioxide. Your carbon dioxide level is, why did I put 34? Just joking, guys. Is 35 to 45. I don't know what I was thinking over here. 35 to 45, that is your normal CO2 level. When you have more than 45, you're more acidic. And when you have less than 35, you're more towards the alkalinic level. But speaking of CO2, CO2 within itself is acidic. So the more CO2 you have, the more acid you're dealing with, right? Now the kidneys, because there's only 2 players in this game, the lungs and the kidneys. The kidneys are responsible for bicarb. Bicarb is what makes things basic or alkalinic, right? Your bicarb level is 22 to 26. And just like when we're talking about carbon dioxide, we're talking about acid. When we're talking about when we're talking about bicarb, we're talking about base. We're talking about things that are alkalinic. The more bicarb you have, the more basic you are. But the less bicarb you have, the more you go into the acidic state. So you guys have to understand those 2 concepts. I go into detail on part 1 about that. Now, pH. This right here, guys, this is our pH. That is the name of the game. The lungs are doing what they're doing. The kidneys are doing what they're doing to keep that pH between 7.35 and 7.45. Everybody's doing things for the pH, 7.35 to 7.45. That is where we want our pH, okay? The lower the pH, the more acidic that patient is. The higher the pH, the more alkalinic or basic that patient is. Did I spell alkalinic right? I don't know. Let me know in the comments. But anyway, the more alkalinic the patient is, that is the name of the game. Now I'm going to show you the method that I like, but I'll also show you the method that I know lots of other people use. I like the Tic Tac Toe, I do too many TikToks. Tic Tac Toe method, but there's also the row method. And so I'll go over both of those for you. So the row method, guys, says, remember the name of the game is for the pH, right? If it's respiratory, if it's opposite to pH, and it's metabolic if it's equal to pH. So if the pH is increased and the, see how this says respiratory is opposite? So if the pH is increased, but CO2 is down, we're talking about respiratory. But if that pH is increased, and so is the bicarb, we're talking about metabolic. So I'll show you. Let's look at number 1. We're going to use this method. This is called the row method. We're going to do the row method for number 1. pH is 7.31. Is 7.31 acidic or alkalinic? Well, let's take a look. Over here, I see 7.35 is acidic. Anything lower than that 7.35, I'm acidic, and we're at 7.31. So we're dealing with what? Acidic. The pH is down. So this is my pH, and I'm going to put down, right? Let's look at the CO2. CO2 is 35 to 45. This CO2 is 50. So I know my CO2 is up because it's more than the 45. Let's look at bicarb. Bicarb is supposed to be 22 to 26, and it's 22, so it's within. So my bicarb, I'll just put a line like this, bicarb, right? Remember, Rome says, according to Rome, it's respiratory if it's opposite and metabolic if equal. We'll take a look right here. My pH is down, so I know I'm dealing with acid. And the opposite is CO2. So I'm dealing with what? Respiratory acidosis. Right here. Respiratory acidosis. This is what Rome is telling us. Respiratory, if it's opposite, if your sign for goes the opposite way of pH, respiratory if opposite to your pH, but it's metabolic if equal to pH. Okay, wonderful, Professor D. It says respiratory acidosis, but I see something over here. What's this? This is supposed to say uncompensation or uncompensated. And let me explain to you what that means. Let's go back to what we have, respiratory acidosis. Respiratory, the lungs, acidosis, CO2, right? So this patient's holding on to too much what? CO2. That's what placed them into respiratory acidosis. Respiratory, the lungs, carbon dioxide, which is acidic. This patient's having too much CO2 in the lungs. Do you agree? Yes, wonderful. What organ did I tell you was the only organ that can help if the lungs are in trouble? The kidneys, right? Okay, follow me. So if the patient's in respiratory acidosis, they're holding on to way too much CO2, and there's only two things that the kidneys can do. The kidneys can either hold on to the bicarb to increase that bicarb level, or let bicarb go to decrease that level. Okay, those are the two things that the bicarb can do. If this patient's already holding on to too much CO2, what do you think that kidney is going to do? Hold on to the bicarb. It wants to increase that bicarb. It's going to shoot out bicarb to bring that patient to homeostasis. I can say that. Homeostasis, right? But look at what the bicarb's doing. Bicarb is 22 to 26. It's within normal value. So the bicarb, the kidney, is just chilling. It's watching the lungs struggle, and it's not doing anything to help. The lungs are in trouble. This patient's in respiratory acidosis. If the kidneys were trying to help, they were trying to compensate, we would see the bicarb increase because the kidneys would be trying to help the lungs. But the fact that that bicarb is within normal limits and not doing anything, it's uncompensated. It's not helping at all. Remember, compensation means to help. And the bicarb's not doing anything to help because it's just watching the lungs go down. All right, let's do number 2. We're going to use the Rome method again. Remember, it's respiratory if the sign's opposite to the pH, but it's metabolic if the sign's equal to the pH. So we always start with the pH. The pH is important to us. Hold on, let me put my phone on do not disturb. One of my students taught me how to put my phone on disturb and oh, okay, I remember. Thank you, Vince. Good looking now. All right, number 2. pH is 7.31. Again, that's the same as before. Look at this, 7.35. It's less than 7.35, so we know the pH is acidic. The pH is down, so I'm going to put a down arrow for pH. Okay, that's our pH. Our CO2. CO2 is supposed to be 35 to 45. Look at the CO2. The CO2 is within normal limits. So I'm gonna put just like this. It's not going up, it's not going down, it's in the middle. Bicarb. Bicarb is supposed to be 22 to 26, but our bicarb is what? No. So I'm going to put a down sign on my bicarb, right? They equal. What happens when it's equal? It's metabolic. See, metabolic is equal. So I'm dealing with metabolic. Metabolic what? Go back to the pH to tell you what we were dealing with. pH is down. So it's metabolic acidosis. Right here. Metabolic acidosis. All right, Professor D, we know it's metabolic acidosis, but is there compensation going on? Well, let's look at the third guy out. This was down. This was down. What's going on with this? Because this patient's in metabolic acidosis, so the kidney's in trouble. The kidney doesn't have enough bicarb. The bicarb is too low. The only guy that can help is the lungs. If the lungs were trying to help, the lungs would be shooting out more CO2, or let me not say shooting out because that's not accurate. The lungs would make the patient hold on to CO2. So the patient's breathing would slow down and they would hold on to CO2 to bring that patient, oh, I'm sorry, the patient's already in acidosis. I was right the first time. Patient would start breathing fast to get rid of the CO2. They start doing this to breathe off all of that CO2 that they have because the patient's already in an acidic state. Well, what are the lungs doing? Nothing. The normal range is 35. Oh, shoot. Number 2. Just guys, I'm sorry. It's been a long day. Kidneys are doing nothing. The normal is 35 to 45. It's 44. It's not doing anything to help. If the lungs were trying to help, we would see the CO2 increase. We would see the CO2 decrease, just joking. We would see the CO2 decrease because it's trying to get that patient out of an acidic state. Right now that kidneys are in trouble, there's not enough bicarb, patient's already acidic. We know that CO2 is acidic. So what would the lungs do to help to get out of that acidic state? It would blow off CO2. Do all of this breathing, get rid of the CO2. We would see the CO2 go down to try to help the kidneys here. But unfortunately, CO2 is not doing anything. That's why it's uncompensated. It's not compensating. It's not trying to help. Does that make sense? I don't like the Rome method. I more like the Tic Tac Toe method. So for number 3, I'm going to show you the Tic Tac Toe. Then you guys decide what method you like. I need a piece of paper. Oh, good. I already have this down. All right. So look at number 3. pH, and remember pH, that's the name of the game, guys. Your pH is 7.47. Is that acidic, alkalinic, or is it normal? 7.47. Well, guess what? pH is 7.35 to 7.45. Here it says it's 7.47. That means we're what? Basic. So I'm gonna put pH under the basic. So we know that whatever's going on with our patient, it's what? Alkalinic. That pH determines if the patient is in an acidic or alkalinic state. We know for sure it's going to be alkalinic no matter what happens. Let's keep going. The CO2, the carbon dioxide, is 48. Well, we know that carbon dioxide is 35 to 45. Anything more than 45 is what? Acidic. Carbon dioxide is acidic. So the more carbon dioxide you have, the more acidic that patient's going to be. So with the CO2 of 48, we're dealing with acid. So I'm going to put my CO2 over here, right? Okay. Now the last guy, my bicarb. Bicarb is 22 to 26. This is 30. Look at this, guys. Where's my bicarb? 22 to 26. Over here, it's 30. Patients got a lot of bicarb, which means what? They're very basic. So under the base, I'm going to put my bicarb. And the reason it's called tic-tac-toe, whichever is a 3, that's what you go with. So this patient is in bicarb, is metabolic. What? Alkalosis. It says right here, guys, bicarb is metabolic. Look at this, bicarb, metabolic, okay? When we're dealing with bicarb, we're talking about metabolic, right? Bicarb, alkalosis. Basic and alkalosis, same thing, guys. So we're dealing with metabolic alkalosis. For number 3, oh, there we go, metabolic alkalosis. But we're not done. Okay, I understand we're in metabolic alkalosis, but is there compensation going on? Are the lungs at least trying to help? Take a look, guys. The lungs, that's my CO2, it's over here. We know that they're trying to help, because if they weren't, they'd be under the normal category, which means they were just sitting back doing nothing while the kidneys were dying, right? But they're trying to help. That's why it's on the abnormal side, it's on the acidic side. They're trying to compensate, but it's partial compensation. Professor D, how do we know if the compensation is partial or if it's complete? Here's how we know it's partial. The lungs were trying, but they didn't do the job all the way. What lets us know when it's complete? When the pH is in the normal place. Because remember, the name of the game, guys, is to get the pH normal. So the lungs will either increase or decrease the carbon dioxide to get that pH normal. And the kidneys will either increase or decrease bicarb, HCO3, to get the pH to normal. So whenever you see that pH in the normal place, oh, they fully compensated. They understood the assignment. They did what they were supposed to do, right? So in this situation where you have metabolic alkalosis, the kidneys are in trouble. The only guy that could help are the lungs, and they tried to help. That's why they're not here in the normal place. They were doing something. But unfortunately, it's only partial compensation because this pH is still on over here and not in the normal end. All right, let's do tic-tac-toe again for number 4. Ooh. No cheating. Okay, number 4. So we have acid, normal, base / alkalinic. All right. So pH is 7.30. Oop, let me put this down for you. 7.30. As we can see, pH is 7.35 to 7.45. Less than 7.35 is what? Acidic. So I'm going to go ahead and put my pH under acidic. The fact that my pH is not in the normal, whatever I'm dealing with, it's not fully compensated. I know that for a fact, right? And the second thing I know for a fact, since my pH is under acid, whatever I have, whether it's metabolic, whether it's respiratory, it's going to be what? Acidosis, because the pH is what determines if you're acidic or you're alkalinic. All right, so we got the pH. Let's keep moving. CO2, what's responsible for our CO2, by the way, guys? The lungs. CO2 is 50. CO2 is supposed to be 35 to 45. So more than 45, I'm doing, look at this, 35 to 45. More than 45, I'm dealing with what? Acidity. So I'm going to put CO2 under my acid. And the last guy, my bicarb, 30. Bicarb's 22 to 26. 30, I know I'm what? Basic. So I'm going to put my bicarb over here. This gives me tic-tac-toe. 1, 2, 3. I got 3 of these. This is what I'm dealing with. CO2, which is respiratory. CO2, which is respiratory. Acidosis. You guys see this? CO2 is always going to be respiratory. I got my tic-tac-toe, 1, 2, 3. And my pH, which tells me if I'm dealing with acidosis or alkalosis, my pH is under what? Acid. So I'm dealing with respiratory acidosis. Right here, here you go. Look at number 4, respiratory acidosis. But we're not done. Is there partial compensation going on? Full compensation going on? No like what's going on? Let's take a look. Respiratory acidosis, the lungs are in trouble. There's way too much CO2 in the lungs. The only organ that can help is the kidneys. If the kidney wants to bring down that acid, the kidney's going to hold on to what? Bicarb. We're going to see that bicarb increase because they're trying to compensate, right? Look at where our bicarb is. HCO3. It's trying to compensate, but it's partially compensated. Why? Because our pH is still over here. If our pH was back to normal, 7.35 to 7.45, it would have been fully compensated, but it's not. It's over here. So we have respiratory acidosis, what? Partial compensation, just like here. Okay. Let's go back to the row. Well, no, we'll do one more tic-tac-toe, then we'll do a row method again. One more tic-tac-toe. Number 5. Number 5. So I'm going to do acid, normal, and then base. Guys, sometimes I say base, sometimes I say alkalinic, same thing, okay? All right, so we're doing number 1. 7.33. Is it 7.33 less? Hold on, guys. I want to make sure you guys can still see this. What number am I on? 5. Is it 7.33 less than 7.35? Yes, so we know we're dealing with acidosis. So let's put our pH under acid. Whether it's metabolic, whether it's respiratory, we don't know yet, but we know it's going to be acidosis because our pH is under the acidosis. Remember, the pH tells you if it's acidic or if it's alkalinic. Let's keep going. CO2, carbon dioxide, is 40. What is the normal range for CO2? 35 to 45. So our CO2 is normal. Our CO2 is normal. Last is our bicarb. Bicarb is 22 to 26. The more bicarb you have, the more base you have, and the less bicarb you have, the more acidic you become. So bicarb 21, less than that 22, we're in what? The acid side. So I'm going to put my HCO3 here. Tic-tac-toe, we got 3 of these. HCO is metabolic. Metabolic what? Acidosis. We're dealing with metabolic acidosis. The kidneys are in trouble. There's not enough bicarb in the kidneys. The bicarb is low. That's what's making the patient be acidic. The only guy that can help are the lungs. What the lungs would have done if the lungs were trying to compensate, patients start doing this, breathing off that CO2, and we would see the CO2 drop if the lungs were trying to compensate, right? Look what the lungs are doing. Lungs are just sitting back, watching the kidneys go bye-bye. So it's metabolic acidosis uncompensated. Look at this right here. Metabolic acidosis uncompensated because the lungs are not doing anything to help. All right, let's do Rome method. Number 6. We're back on Rome. Remember Rome? When we're talking about the pH, to the pH is respiratory if it's opposite, metabolic if equal. So let's look at this. 7 point, did I just do number 5? Yeah, I just did number 5. Sorry. Okay, number 6. 7.48. The pH. pH is 7.35 to 7.45. More than 7.45 is what? Basic, alkalinic. So that pH is up. So I'm going to put an up for my pH. Right? Right. Next, the CO2, 45. What's our normal CO2? 35 to 45. So it's within range. So it's going this way. Does it go up? It doesn't go down. The CO2 just stayed this, like it's within normal range. Okay. Next, bicarb. Bicarb's 22 to 26. This is 30. So this patient's very alkalinic. The bicarb is up. Let's go back to the Rome method. It said respiratory is opposite. My 2 signs are not opposite, but metabolic, if they're equal, my 2 signs are definitely equal. So I know I'm dealing with metabolic, right? Metabolic what? Because this is my HCO3. I'm dealing with metabolic, what? pH is up. Alkalosis. The pH is up. That lets me know we're in alkalinic state. And the bicarb is metabolic. Metabolic alkalosis right here. Oh. Metabolic alkalosis. Okay, great. We know it's metabolic alkalosis, but what about the compensation? Look at what the CO2 is doing. Absolutely nothing. CO2 is chilling in the cut. So it's uncompensated. They're not even trying. It's not even partial. It's uncompensated because it's normal. Does that make sense? All right, guys, one more, and then you guys are gonna have to try these on your own. Practice, practice, practice. If you want me to do a part 2, that's not a problem. But there's also something else I want to cover with you before I let you guys go. All right, last one. This one we'll do tic tac toe, acid, normal, basic. All right. pH 7.33. That's what? Acidic. That's less than 7.35. So I'm going to put pH here. So we know for sure we're dealing with acidosis. We don't know if it's respiratory or metabolic, but we know for sure we're dealing with acidosis. CO2 49. CO2 is 35 to 45. 49, that's acidic, right? So I'm going to put my CO2 under acidic. So now we know for sure. Now we know for sure we're dealing with respiratory acidosis. Respiratory CO2, remember the lungs are responsible for CO2, and the pH is under acidosis. So we're dealing with respiratory acidosis. Okay, great. We're dealing with respiratory acidosis, but we're not done. Our bicarb is 26. Normal bicarb is 22 to 26. So our bicarb is normal. It's not doing anything to compensate. So it's respiratory acidosis uncompensated. Right here, respiratory acidosis uncompensated. And guys, that's how you figure out if your patient is in metabolic acidosis versus alkalosis, respiratory acidosis versus alkalosis, compensated, partially compensated. Okay. Practice, I suggest whichever method you like, whether it's a tic-tac-toe or the Rome method, stick to one and keep to that one. Unless you're confused about something, then you could try both ways just to make sure. But that's how you figure that out. One more thing I want to talk to you guys before I let you go, because I got to take my kid to soccer. Let me see what time it is. How much time do we have left? Jeez. Okay. Part 1. Excuse me. I told you to make sure you know this. Very important to know. Don't forget, the pH is what lets you know if you're in acidosis or alkalosis. Okay. This is a Rome method. This is just very wordy, so I don't like it. But anyway, if this works for you, this is the Rome method. This is the exact same thing that I just taught you about the Rome method. I just feel like they use way too many words to say something as simple as what we just did. Moving on. Let's talk about solutions. So the first thing we're going to talk about, hypotonic solution. A hypotonic solution has more water than electrolytes. Think about it. Hypo, that means low. Tonic, tonicity, how many solutes are actually in the fluid. So when it's hypotonic, there's way more water than those solutes. Look at this, hypotonic solutions have NaCl are useful in treating patients with hypernatremia, and they're good maintenance fluid because normal daily losses are hypotonic. So this is very important for you guys to know. Look at this. They are not good for replacement because they can deplete the extracellular fluid and lower the patient's blood pressure, excuse me. So this is great, guys, for a patient that has hypernatremia, because think about it. Giving them a hypotonic solution, they're getting more fluid than solutes, which is great because in hypernatremia, they got way too much sodium. Does it make sense that we give them more of those solutes? No. So patient who has hypernatremia, we're trying to dilute all of those solutes. A hypotonic solution is a great solution to give them. But it's not good for replacement because they can deplete the extracellular fluid and lower that patient's blood pressure. Think about it, fluid goes where the salt goes. So if you were to give a hypotonic solution to a patient that their sodium was already low and you made it worse, you think that fluid's going to stay within that vascular space where we needed to increase the blood pressure? No. So that's why it would not be a good fluid to give to a patient. Now look, because hypotonic solutions have the potential to cause cellular swelling, monitor a patient for changes in mentation that indicate cerebral edema. Those are one of the first signs and symptoms that they're getting too much of it. We're going to see a change in their cognition. We may see confusion, changes in their mentation. So you have to watch the patient, their CNS very, very closely. Now let's talk about isotonic. The isotonic solution has a similar concentration of water and electrolytes to what? To plasma, to the blood, which is great for the patients that need it. Look, because of the similarity, again, guys, those isotonic solutions have the same solution balance, I should say, to your blood. Because of the similarity, administering an isotonic solution expands only ECF and the fluid does not move into the cells. That is great for a patient that's going through dehydration, severe dehydration. For example, when you have a patient has a large burn, they will go through severe dehydration because all of the fluid that was in the vascular space leaves the vascular space and goes out into the tissues. So here you have this patient looking like this. They're swollen and you're thinking they got way too much fluid. All of that fluid that makes them look swollen is in the tissues and not in the vascular space where it needs to be. So even though they look swollen, they're actually dehydrated. So isotonic fluids is a great fluid to give a patient that's dehydrated because it stays in that vascular space where we need it to be. This makes isotonic solution the ideal fluid replacement for patients with extracellular fluid volume deficits. Examples of isotonic solutions include, and you have to know this, guys, that's your normal saline, your 0.9, that's your normal saline, and the 0.45 is your half normal saline, okay? Your normal saline and lactate ringer solution. Let me tell you something. If you don't listen to anything else that I tell you, I promise you, I don't know how many times NCLEX has asked about this. You are expected to know, and they always use the same example, patient that has major burns. So you're supposed to understand the patient who has major burns goes through dehydration very quickly. What are we going to use to replace that volume? And lactate ringers is our #1 choice, okay? So don't say I didn't warn you. Move this down a little bit. How am I doing on time? Oh my gosh. Okay, guys, I gotta run. Isotonic saline is used when the patient has experienced both fluid and sodium loss, such as diarrhea, vomiting, and it's the fluid of choice for replacement. Whenever you guys see fluid of choice, drug of choice, treatment of choice, make sure you know whatever that book is talking about. It's important. They're not telling you that for any reason, okay? So this is important to know. Next page, this table, it goes on commonly used crystalloid solutions. And I want to bring this to your attention. Your normal saline, look at this. Only solution that may be administered with blood products. You cannot give dextrose with blood products or anything else. It's got to be normal saline. You have to know that. And it can cause fluid volume overload in patients that have heart or kidney disease. If they have heart disease and they already can't pump out the blood that they have, does that make sense to give them all of this fluid that they would be holding on to? You think the heart will be able to handle that? Or if the patient has kidney disease, they already can't filter out the toxins, the kidneys already overworked. Does it make sense to give them all that fluid where the kidneys will try to flush that out as well? So that's important for you guys to know. And I want to show this to you on the bottom. Lactate Ringer is used to treat hypovolemia. Remember, it's great for expanding the volume within the vessel, because remember, with lactate ringers, it doesn't seep out of the vessel. It stays where it's supposed to be. So it's used to treat hypovolemia, burns, which NCLEX loves to ask about, and GI fluid losses. And I think that's it. All right, that's it for this part 2. So guys, I hope you found this to be helpful. If you want me to do more practice problems with you, or if there's something else that you'd like to see me cover, please sound off in the comments. Let me know what you thought about this video and what you'd like to see more of. Guys, thank you so much for watching this video, and you'll see me on the next video.